Well, hello there, everyone. Thank you for joining us today, and thank you for taking the time to come back. And we're excited to have the opportunity to recreate this and give you all that information. So welcome. This is Denise Noyer-Erez with AIM Wellness Clinic, and I am excited to host this teleseminar webinar with two beautiful people that specialize in fertility as well. And so welcome to our Aim to Get Pregnant Teleseminar webinar. My intention for you is for you to discover get some insight about how your body is and become more informed about fertility and testing of fertility, so maybe it doesn't feel so scary, and that you can make your own decision based on where you are today, and to give you some coping mechanisms that can help support you until you do conceive. So how it's gonna work today is we have three speakers, and everybody's gonna speak for approximately 30 minutes, 40 minutes at the most. Because of the timing, we may not have time for questions, but we will do the best we can. So if you happen to be at a computer, there is a chat room, and we'll try to take questions after. And I'll remind you, if there is not time and you have some burning questions that we weren't able to get to, then we'll make sure you have our contact information so you can email us and we can get back to you with those questions. So Sara is going to go first, and she is going to be speaking about the ebbs and flows of the emotional cycle when you have that negative pregnancy test. And she's also going to be giving some tips to keep it spicy in the bedroom, because sometimes a lot of our patients, sex becomes a job. So we want to make sure that stays fun. And then Dr. Winkler is going to be giving you a lot of insight on fertility testing so that you become more aware and more knowledgeable of what tests you may possibly need, and they don't become so scary. And myself, I'm sharing with you how to supercharge your fertility and ways that you can find in your body. Sorry about that. And ways that you can acknowledge see what's going on in your body. So let me start by introducing Sara. Sara Rector has been helping individuals and couples cope with infertility since 1980, and she has been in her private practice since 1994. She's the director of the Circle of Life Center, which is a full-service infertility support center providing information, counseling, and individual couples and groups. She leads support groups for Resolve. She's also created a reproductive wellness MP3s and CDs series, which includes information on positive intention conception, relationship issues and infertility, the male factor perspectives and experiences of infertility, and healing pregnancy, loss, and transition to donation. I've had the privilege of working with Sara Rector for almost 15 years now. We've had patients, and she just really attracts beautiful women that are so supportive and nurturing in her groups, and she really creates an amazing safe space of support. So without further ado, I would like to introduce Sara Rector. Hi, Sara.
Hi, Denise. Hi, thank you for the beautiful introduction, and it's my pleasure to work with you. I always really enjoy your healing energy and get a lot of positive feedback from my clients, our patients that we share together. And I always love laughing with you. You know, life's too important to be taken seriously. And boy, I'll tell you, this going through infertility can be a dark cloud. So so I'll get more into that, the dark cloud and the bright sunny day. But I want to offer to everyone that's on this teleseminar a free gift. And what I'd like to offer is that you get to pick out one of my reproductive wellness MP3s. So Denise had mentioned the choices: positive intention conception, relationship issues, he said, she said, which is me and my husband interviewing each other. So that one's kind of funny. You get to hear about his date with a cup. Healing pregnancy loss, and then the transitioned in ovum donation. So I will email you the link, and then you can respond with your choice. And so you can email me right now at Sara Rector, SARARECTOR, MFT, M as in marriage, F as in family, T as in therapist, at gmail.com to request your free link to the MP3. And also what I'm going to include is 10 strategies to cope with infertility as a couple. And any questions that you may have, go ahead and email, and I'm happy to answer them.
Wow,
So,
that's generous. And we're putting that in the chat room as well.
Perfect. Thank you so much, Denise. And thank you for setting this up and creating this great space, this great healing space where we can share information to support people going through infertility. So what I want to share, I have a lot of professional experience with family building and supporting individuals and couples that are going through infertility. And I just want to share with you that I also have a lot of personal experience. And that really is the most soulful part of what informs the work that I do, because there's a special kind of knowing that happens when you've gone through this experience, and it is an experience that is defined as traumatic. Traumatic is a negative experience that most people in the general population do not experience. And the last time I checked, it was 1 in 8 individuals deal with and go through infertility. So it is a challenging time that I personally experienced. And so that's how I got here. So I just want to give you a little bit of information about that so you can get to know me. And then I'm going to talk about, as Denise said, the emotional ups and downs of infertility, which really is what they've called the emotional roller coaster of infertility. And it's tied to our menstrual cycles and also our treatment cycles. And this affects us individually, it affects our relationships, and it affects us in the bedroom with our partner. So that's going to be the second part of my talk. And then the last part will be solutions. So we're going to talk about the issues and the problems, but really, most importantly, we're going to focus on what you can do and what the solutions are, the coping methods, the problem solving, and of course, my favorite, keeping it exciting and spicy in the bedroom. So, okay, so let's kind of rewind. And so once upon a time, I was a 30-something, and I actually, before I took a detour, a 10-year detour into the corporate world. And so I graduated, I got my degree in psychology, and I took a detour into the corporate world, and I worked in sales. I sold Yellow Page advertising, actually, and I was then able to become a manager of salespeople that sold Yellow Page advertising. For back then, it was called GTE. Now the company's name is Verizon. And so back then, I was a corporate woman, and I was making money, and I decided that I'd get married I'd get married in my 30s, and then when things kind of settled down, then I would have a baby. So that was my plan. I actually ended up meeting the love of my life and getting married in my mid-20s. I didn't want him to get away. And we just had this fabulous life. I just made a ton of money. I was very successful in sales. It really worked out for me. And we traveled all over. The company sent me on sales trips that I won to Europe. We went a couple of times, and we just did whatever we wanted, whenever we wanted. And it was really an exciting and fun lifestyle. So then all of a sudden, my younger brother, who also was married, he and his wife had a baby. And I got bitten by the baby bug. I fell in love with my nephew. I just can get enough of him. And I live in Thousand Oaks. That's where my office is and my practice. And I would travel all the way to Orange County as many weekends as my husband would agree to. I would just wanted to be there all the time because he just fascinated me. And he just was a little miracle. So then I decided that I wanted to have a baby. And I actually I was in my late 20s. So then my husband and I went about the quest to have a baby. And one of the things that I had learned in sales was about goal setting, setting goals and writing your goals down every year and checking in and seeing where you're at with your goals. And I learned about positive intention and positive thinking and the power of positive intention. And that formula had really worked well for me in sales. And really, I attribute a lot of my success to that goal setting and then positive thinking. So I went about it the same way that I went about my sales goals. I set my goals for the year, and on that list was have a baby and, of course, lose 10 pounds. Well, all of you that have gone through this journey know that losing 10 pounds and wanting to have a baby, those two do not mix at all for many, many reasons. The treatments cause us to gain weight, the hormones. I don't know about you, but I'm a stress eater. I love to eat. So I eat, happy, sad, stressed. And so that's my story. So for 7 years, I put on my goals at the beginning of the year, have a baby and lose 10 pounds. I think it actually went up to 20 pounds towards the end. And for 7 years, I did not achieve my goal. And each year it became sadder and more disheartening for me and frustrating. So eventually we did decide to go see a reproductive endocrinologist. I think that's really, really important to go to a specialist if you have been trying to conceive for a year or if you're over 35, because they really know what they're doing. They know all the latest and the greatest techniques and tests, and I'm sure that Dr. Nurit is going to speak more to that. So please don't waste your time with an OBGYN because they're very limited. There are some things that they can do, but there's a lot of things that they're not aware of. And the diagnostics is just so important. So we finally did go to a reproductive endocrinologist, and we also went to an acupuncturist, which I highly recommend. It was so helpful and relaxing, and it's just those magic needles are amazing. So that was part of our treatment plan, and we went through an in vitro cycle. And what I did is I created a treatment plan to accompany the IVF cycle, because my experience was I just felt like something so sacred to me as creating a child had become very medical and profane, and I really was struggling with that. So what I did is I used all of my positive intention techniques that I learned in sales, goal setting, and then I combined those with what I had learned in becoming a therapist. Oh, and I'm remembering I left out a piece, and that was that I was in sales, and part of that 7-year cycle, I realized that I really was having difficulty because I was out of town quite a bit. Sometimes I was out of town for 6-month stints. So I realized that my lifestyle was not conducive to having a baby. So this is really something important to think about too, because when I was in Las Vegas for 6 months, that was during my fertile time 6 times. And I wasn't always, I went home on the weekends, or my husband would come up on the weekends, but that wasn't always the best timing. And back then, sperm doesn't really fax that well, or, I don't think, I still don't think you can fax it, but that lifestyle wasn't conducive to getting pregnant. So what I ended up doing is I ended up leaving the sales career and working on my first love of becoming a therapist. And so I did do that. And so that was really helpful because I learned a lot of techniques to support me during this trying time, coping techniques and strategies, relaxation techniques. So forward to going through an IVF cycle, what I did is I utilized everything that I had learned through my education, through my personal experience, through my struggles, and I created the positive intention conception treatment plan. It's a psychological treatment plan that supports you when you're going through these treatment cycles. And I created it because I really needed that kind of support to accompany the medical treatments that I was receiving, and to create that positive intention. So I went through my IVS cycle, and I used these techniques that were supportive, and created the positive intention. And I actually got pregnant the first time. So it was really a blessing. It was really stressful, but it worked. So that's how I got here. And then what happened is that I went into this field, and I met some amazing people, Denise being one of those people. And then I got to help other people deal with the emotional ups and downs of infertility and menstrual cycles and relationships. So let's get into that part of the talk. So what happened to me, and what happens to the women that I work with, is that they experience the emotional ups and downs based on where they are in the cycle. And so we go through this period where we are usually, there's a downtime right before the cycle, where we are very upset because the last menstrual cycle did not result in a pregnancy. And so then what happens is, when we seek medical treatment, that allows us to become more hopeful. And so we're seeking the treatment, and then a lot of times it's really helpful to have a support system, like a group. Like one of the things that I run that really helps the women is a Resolve support group. And I also recommend that people get connected to Resolve, which is a national infertility support organization that has a lot of information, a lot of different ways to support people going through infertility. And that's at resolve.org. And so going back to the ups and downs, so then as you're anticipatory of the cycle, then we start to get more hopeful, and maybe we even go through a treatment cycle. And then we have the waiting time, the 2-week wait, which is very nerve-wracking. And then when it does not result in a pregnancy, then that's the downward slide. That's where we can crash and burn and become very depressed, isolated, hopeless. And it's really hard and depleting to go through this cycle every month. And of course, it affects the bedroom because we start feeling like we are being very unsuccessful in the bedroom. And so we start to have negative feelings about sexuality, maybe our partner's sexuality, the sexuality that we have together. And so it can cause a lot of issues in the bedroom. In fact, it's funny. My husband and I attended a Resolve conference many years ago. And, we have a 20-year-old daughter who was conceived through in vitro fertilization. And so it was many years ago that we went to this conference, over 20 years ago. And there were different talks that you could attend. And my husband and I split up because we really wanted to soak it all in. And so I picked the one about sexuality and sex because I like sex. And I was really disheartened by this emotional roller coaster ride that we were on individually and then also as a couple. We had many cycles that resulted in failure. And so what that creates in the bedroom is a sense of failure individually and as a couple. So anyways, I happened to go to that particular workshop, and the woman that taught it was a sex expert. She didn't really know about infertility, but she knew about sex. So she actually started talking, and here we are, we're kind of an angry group of, I guess, sexually frustrated people, definitely frustrated that we weren't conceiving. And so she started to take some notes, and, how does this infertility affect your sex life? And so she started to jot down that a sense of failure. She started to write down, we were talking about how that sex needs to be timed. And she just started writing down this long list. And she said, you have every element of sexual dysfunction in this list. And so no wonder this is an issue. And so I'm going to talk more about solutions to that. But going through infertility is just so pervasive. It really can negatively impact how we feel about ourselves as an individual, and how we feel about our relationship, and then how we feel about our sexuality. So it really is very pervasive. That's one of the reasons that it's traumatic, because it negatively impacts all these areas of our lives, or it can negatively impact. It impacts our work life, because we need these medical treatments, and we need to leave work at the most optimal time. And so we're constantly needing to leave work for appointments, and we really don't necessarily want to disclose why we are leaving work, because it's very personal and private. So it just really creates a lot of these particular challenges. So let me just move on to some solutions and coping mechanisms that are very helpful in problem solving. And then last, I'll close on keeping it exciting in the bedroom. So this is what I found that worked for me. I actually ended up joining a group. So for a long time, infertility was my dirty little secret. And I felt really, really bad about myself. And I find that my clients feel this way too. I felt that there was something wrong with me. And, I did have a medical diagnosis. I was dealing with infertility. We did try for 7 years, and finally it worked. That we went through IVF and conceived our daughter through IVF. But at the beginning, it was my dirty little secret. And so once I started to share about that and learn other people that were going through similar processes, I actually joined a group. And that was so healing for me to hear other people that were thinking and feeling the same way that I felt. That was an amazing experience, to share about my thoughts of going to Mexico and seeing the little beggar children and wanting to kidnap one of them and bring them back to America, and feeling like, okay, that's a little crazy. And then having other women in the group say, oh yes, I felt that too. Just various different feelings of not wanting to go to baby showers. And then feeling bad about yourself because you didn't want to attend. But that's really normal and natural. Of course you don't want to go to a baby shower. That's incredibly painful. And so these are the things that I learned in my group. I learned about how other women were having issues with their husbands and their partners, because they had a different way of coping and dealing with things. And so what happened is, instead of bringing the couple together, there were times when each member of the couple felt very, very isolated with their own thoughts and their feelings. A lot of times I have men and women come to me, and the husband is so relieved. It's like he kind of wants to drop his wife off at the office so she can talk about her feelings, because he has a lot of feelings too, but he wouldn't dare bring up the subject because he feels like then the waterworks come. And then, he just kind of opened Pandora's box up. So, it can create a sense of isolation in the couple. That's why it's really important for the women that I see. They come and they get the support, and they come and they join the group, and they come and they talk to me individually. And then, sometimes I do see couples also, or we do a treatment plan where if couples therapy is warranted, we do that. It's the treatment plan is custom designed for each person that comes to me. And so it's really a relief for a lot of the women I talk to have a place where they can talk about their feelings. And it's also a relief to their partner, to their husband, that there's some place where she can talk about this, because there's a sense of overwhelm for everybody. It's a very, very overwhelming, emotionally overwhelming experience. What could be more compelling than wanting to reproduce? I mean, really, if you take a look at all animal behavior, it's all centered around reproduction. I went to Montana. I love Montana. And I saw these big elk horns. And then they shed the elk horns after mating season. And I just learned about the elk horns, that the way the elk horns work for the males is that the more ornate they are and the more they have that horn fuzz on them, I guess, that's more sexually attractive to the females. And so they are able to mate with more females. And so this is all based on fertility. So many other examples of animal behavior, and we're part of the animal kingdom. So we're very, very compelled to reproduce. And when we aren't able to do that, it's very emotionally and developmentally stunting. So what happens to us when we're going through infertility is it really can isolate and separate us from the people that we're friends with, the people that we know and we love. People get married and you have couples friends, and then what usually happens shortly thereafter is people start having babies. And that's what happened with my husband and I. And initially it's like, well, we're gonna be focused on our careers. But then when I got bitten by that baby bug, I just was heartbroken. I was heartbroken every month. When my period came, and that was that emotional roller coaster. And I was heartbroken when my friends were having baby number 1, baby number 2, baby number 3. I mean, it just was really so sad for me. And then I felt bad about myself because I had an emotional reaction. I had a reaction where I didn't want to be around these people. And these were my dear friends. And so that was really with this, and go through infertility. So when I found the Resolve group, my Resolve group, it was such a blessing because these women really got it. They really understood. They didn't think I was nuts when I wanted to kidnap the baby off the streets of Mexico. One woman, my neighbor, I had a neighbor that was in my group too. She's a little bit older than me, and she had been through 10 years of infertility. And so anyway, she was in my group. And then there was one woman in our neighborhood who, she just kept popping out the babies. I mean, oh my gosh, I think she ended up having 6 kids. And so I was telling my neighbor, Maureen, I said, gosh, Maureen, I'd like to drink what's in her water over there at her house. Cause man, whatever she's doing and the water she's drinking is better than my water. Cause it's not happening. I'm not getting pregnant. And then I hope I don't offend anybody here, but, Maureen was very forthright and direct. And she says, screw the water. I want to F her husband. And I just started laughing. And, I mean, this is what happens to us. It's like cut to the chase. So, anyways, it was so good to be connected with this group of women that totally got me we were able to share how we were thinking and feeling, and the other women didn't think we were crazy. They took it up a notch like Maureen did. And then we were able to problem solve. We were able to talk about our treatments, our treatment plans, different tests that we had taken, what our diagnoses were, what the symptoms of the diagnoses were. And this was very helpful. It really informed us as far as then we were able to have a collaborative discussion with our doctors. And what's amazing about reproductive endocrinologists is they're an incredible breed of people, because it very much so can be a collaborative process. They are open to that. It's not a situation where the doctor tells you. It's that it can be collaborative in that you tell the doctor what you're experiencing, what you've researched, and the doctor then can share with you what they think is recommended in your particular case. So it just takes the treatment level up a few notches. And that's one of the things that happens in infertility, is that before I started infertility, I thought that, well, the doctor is the expert. The doctor has the answers. The doctor will fix this problem for me. And when I started to seek treatment, I realized that there's a reason why they call it art. It is the art of practicing infertility, in that there are no definitive answers. In a lot of cases, that it's trial and error, and sometimes we don't know why certain things work, sometimes we do, but it's quite a learning curve to learn about all the various possibilities, treatments, the pros and cons. And that's another way where the group really came in handy with the problem solving, was that it was like we had 6 people on our team, and we were all doing our own research. No one can research like a woman going through infertility, let me just tell you. But you have to be careful with that, because there are sources that are better than others. So you need to stick with sources that are authoritative and not anecdotal, and that are legitimate. And so that's also the value of the group, is to really brainstorm, and really it really helps you get to the essence of what's going to be helpful for you. So, all right. So this is, I'm talking about how beneficial the group was for me, and I highly recommend the group process as a resource, along with individual and couples therapy as needed. You know, with your other professionals, they are very, very good at what they do. They only have a certain amount of time they're able to spend with you. And these treatments, there's a lot of questions, and it's very emotional. It's very emotional to make these transitions. And so having a therapy group, having a therapist for individual or couples support, having a consultant is very, very important. My passion is to do all of those things, because this is my work I'm passionate about because of my own personal experience. So, all right, so let's see here. What else do I want to share with you? So I'm sharing about the group and the support. And I want to tell you a little bit more about the group I was in. So what happened in the group is the group turned into a mommy and me group, if you can believe it. I think there were about 8 members that we had, and we all became mothers in different ways. And so that was kind of exciting, just to learn about all the different ways that one could be a mother. We had people that became mothers through ovum and sperm donor. We had people that one woman became a mother through surrogacy. And she's an amazing woman. She's actually a storyteller. She's a very kind of a famous storyteller named Vicki Juditz, and she tells her story about going through infertility, and she has a lot of other stories too. She speaks, does her storytelling through tasty words. If you want to look her up, she's incredible, an incredible performer. And so that's how she became a mother, and she was in our group. And there were women that became mothers through in vitro. I was one of those women. And we had women that adopted. We had women that, we had one woman, we had women that became mothers through insemination, IUI. And one woman was in the group, and she had secondary infertility, which means that she conceived her first child easily, but the second child was more difficult. And she was going through different treatment cycles, and then her doctor was not available during her fertile time, and she actually ended up conceiving on her own. So that was pretty amazing. So all of our babies came to us in different ways. But what we realized when we became a Mommy and Me group was that that was really secondary when we went on about the business of becoming a mother. And so that was a really powerful awareness that I think I really want to share with you, is that it's really getting clear about what is your ultimate goal too. That's part of what's going to be part of your treatment plan. If your ultimate goal is to have a baby, period, through any means, and you're clear about that, then you have a lot of different options. Some people get very clear that they just want to have a baby that has their own genetic material. Other people are willing to adopt, willing to use surrogacy, willing to utilize embryo donation. So these are all different options. And sperm donation, egg donation. And so this is part of what I explore with individuals, couples, and then also in the group, is choice making, because there are a lot of choices. Going through this process is, it's fraught with so many choices that people don't need to decide. When I was going through this process, I knew a few different people that had accidents, that they had oopsies and accidents, and they weren't even married. And so their process was so unconscious. And I remember hearing a story about a woman who didn't even know she was pregnant, and then she ended up giving birth on her porch. And it just was like astounding to me, like, oh my God, how could that happen? I mean, I'm going through all these infertility treatments, and I'm constantly checking my mucus and my cycle and so on. And this woman's so unconscious. So what happens is you become very aware and conscious, and you have a lot of choices to make, which is very stressful. So having that support is very, very critical as you go along the way. Having other people that are informed about the choices that you have to make, and then they're also going through similar choices. So this is the value of doing, getting the therapeutic support or the consult support, is having that resource, because it's a really, really stressful time. And going back to the group that I was in, it was really the silver lining. These women that I met are, to this day, the majority of them, my best friends. We went through so much together that we formed a bond. What doesn't kill you makes you stronger, and pain is very bonding. And so these women are my friends. Our children are friends. It's amazing. Our children are friends. Our husbands are friends. They're family friends. We have gone through so much together. We went through infertility, and then, like I said, the group became a Mommy and Me. And then we went through babyhood, toddlerhood, school-aged children, teenagers. That was fun. Sex, drugs, and rock and roll. Now we have young adults that are in college, and we are still connected. And these women and these families are some of my best and dearest. So that was a silver lining of my dark cloud. And actually in the groups, that's really my vision for the groups. And it's so beautiful for me and so fulfilling, because that's what's happened. I've been running the groups now for 15 years, and these families, these women check in with me and just tell me, that they've talked to so-and-so, and this one's kid just graduated. And I mean, that's my vision, and that's the beauty, is that you can form these connections that will be your village as you go through all of these ages and stages. So I'm looking at the clock and I'm thinking I better start talking about sex because I'm going to be running out of time here soon. So let's just highlight that, because I have given you some solutions and coping methods and problem solving. And so here's the thing with sex. Like the sex therapist said, I mean, this whole going through infertility is really counterintuitive to having an exciting and a spicy sex life. So the key is that one of the main keys is that you take breaks from trying to conceive a child, which seems very counterintuitive because I know how passionate we can get about wanting to have a child. But sometimes that focus and that passion can be very, very damaging to us individually and very damaging to our relationship. Sometimes, a lot of times going through infertility is like running a marathon, and you really do need to pace yourself. You need to take breaks. You need to take sips of water, get some sort of so that you can make it all the way through. So that's why taking breaks is really, really important. Also, too, if you have a miscarriage, I mean, physically, sometimes that can be part of this process, unfortunately. And physically, you need to take a break. And a lot of times, the doctors will support and encourage you to continue the treatment cycle and just to keep going. But I really want to encourage you to really check in with yourself and know that it's okay to take a breather and a break. And actually, one of the things that's going on right now that for years that I talk about with my individuals, couples, and my group, is that really one of the most difficult times to go through a treatment cycle is December. And so it's really about taking a break and not cycling in December, because December is such a action-filled month, a stressful month of so many different activities and parties, and so really, really important to not have the additional pressure of going through a treatment cycle. And a lot of times, doctors' offices have times when they're shut down, and other businesses that support the fertility community are closed because of the holidays. So it's just a really good month to take a break and just focus on celebrating that feels good to you. And I'm just going to side note that a little bit further because we are approaching the holidays. And don't worry, I'll get back to sex. So side note on the holidays, there is a saying that comes from the 12-step community that is HALT. And it stands for never get too hungry, too angry, too lonely, or too tired. And so during the holidays, it's really a recipe for all of those things. We don't necessarily regularly feed ourselves because we're very busy doing all the extra tasks that the holidays bring about to our already busy lives. And we may be hungry for other things other than food. Maybe we need some quiet time, some meditation time, and to it's interesting. The holiday time is a time where it's there's a lot of anger. I live on a main street, and I avoid that street because the driving on that street during the holidays is really angry and dangerous. Because I think we just get stressed out because we've got so many things to do and not enough time to do it. Lonely is. We can be lonely amongst all of the parties and the crowds and so on. And tired goes without saying. So when we're going through infertility, we have all of these experiences too, because again, we're in a situation that most people don't experience. We have busy lives. And so going through infertility is like a full-time job. And so that is an overlay on top of what we're already doing. So it's really a great tool, a great check-in tool for the holidays or for just really any time, is to check in with yourself and just ask yourself, how am I doing? What am I feeling right now? Am I hungry, angry, lonely? One of those things. Do what you need to do to practice self-care and to take care of yourself in those arenas. So taking a break. So I recommend taking a break around the holidays, and just checking in and just taking a break when you're feeling like you're at the end of your rope. So when you take a break, this is how the sex part ties in. So when you're taking a break from a treatment cycle, it's really a good idea to completely take a break and not do anything that would result in a pregnancy. So you're going to give yourself and your husband, your partner, the month off. And you are not going to do anything sexual that would result in a possible pregnancy. Off the emotional roller coaster, and you're going to have fun. So that's a time when you just do sexual things for fun. You surprise one another. You can go to, there's amazing stores, or you can go online and get some toys and some negligees. Victoria's Secret's amazing. I love that store. So it's fun to maybe take a trip over there, or go online yourself with your partner and pick some things out, some toys, some lotions, some potions, some lingerie, and just create this fun haven for yourself, and reconnect with one another in a way that is not results driven, which is so counter to sexual desire. So I recommend that. Victoria's Secret's wonderful. There's a place for those of you that are local in Ventura called Aphrodite's. Love that place. It is designed for women. They have lingerie downstairs. You go upstairs, and that's where they have all the toys, and they'll help you, pick out what you need to enjoy sexuality for yourself with your partner. So this is what I highly recommend, is that you reconnect with yourself and you reconnect with your partner just for pleasure, just for fun, and you take a break from that emotional roller coaster of sexuality. Getting away, planning a trip, taking a bath together, just the things that you really enjoy. Buying yourself lotions and potions, and really exploring, different scents that you like that make you feel sexy, which is actually aroma is the most direct route to the brain. And so we have these positive associations with aroma. And so that's a really important component. And actually, it's part of the creating a positive intention conception, which is a multi-sensory approach. And scent is part of that. I actually had a woman in my practice who had a negative association with her doctor's office. She ended up she went through a fertility cycle, and she had a pregnancy loss and had to do a D&C. And the doctor's office got new carpeting during this time frame. And after she completed her D&C, she did not return to the doctor's office, because every time she smelled that smell, it reminded her of her loss. So you can see how powerful these associations are, how we couple them with positive and negative experiences. So you want to use the aroma that is coupled with positive experiences, so you can create that positive environment. And with regard to sexuality, you pick an aroma that is that makes you feel sexy. An interesting note: research has shown that women like the smell of baby powder and baby lotion. They consider that sexy. So that's really tied back to fertility. And I think men, the number one fragrance for men is vanilla. So do your own research on that, but really allow yourself that break, and really allow yourself to get into that whole sensuality experience, reconnect back with what that is for you and what that is for your partner. So I think that I've kind of given a topical overview of the different things that I wanted to talk about. So I think what I will do is turn this back over to Denise.
Thank you, Sara. Thank you so much for your time and all your insightfulness and support. I really appreciate it.
Oh, I really appreciate you.
Gave some great tips.
Yeah.
Thank you.
All right. Take care, and thank you for including me in this wonderful discussion.
My pleasure. Thank you. Have a great day.
All right. Thanks, you too.
Okay, so that was some great tips. I hope that you found that helpful. Now I get the pleasure of introducing Dr. Nurit Winkler. She is a reproductive endocrinologist and infertility specialist. She's going to be talking to you about fertility testing. And so we kind of had the little of the emotional component, and now we're going to get into the technical side. Anyways, Dr. Nurit Winkler she's double board certified in obstetrics and gynecology and reproductive endocrinology and infertility. She has a strong inner belief that nature plays an important role during infertility treatment, and she tries to integrate a more holistic approach. She believes that each patient is unique in their underlying diagnosis and response to fertility treatments. So she adjusts her protocols to meet each individual's specific needs. Dr. Winkler is skilled in many different fertility treatments, such as IVF protocols, natural frozen embryo transfer, standard IVF, mini IVF, pre-implantation genetic screening, also you may know as PGS, egg freezing, egg donation, and surrogacy. Dr. Winkler, I've had the pleasure of working with her, and I've seen her help the couple. What's so wonderful about her is not only is she brilliant and an amazing doctor, but she is so caring, and she really just takes the time to listen to your specific needs so that she can help guide you and get you to get pregnant the safest and fastest way, and also the easiest way. I've had many patients where she's just really supported them trying to get pregnant naturally. And then, of course, if something else needs to be done, she's always there to support them as well. So I just really admire her. And Dr. Winkler, thank you so much for taking the time to be here today and share some of this valuable information. So without further ado, please take it away.
So good morning, everyone, and thank you for joining this panel. I just feel so great being part of this panel of specialists. And Sara, I've just listened to your talk, and I couldn't agree more on everything you said. Going from positive reinforcement in life in general to, the stress of infertility. When they looked at, when they look at stressful in life, there is like cancer and death, and infertility is really up there. It's such a big toll on couples and singles, and the need to find support and the need to understand that. And even more so, as you mentioned, it's very important in each treatment will be specific for the patient. So I can come out and say, you know what, statistically, you'll do better with IVF, but this is not what they feel they want to do. And I believe, like with anything in life, you should really do what you're comfortable with, and no matter. So I think the role of a fertility specialist is, of course, have all the knowledge and the expertise of sitting down and said, okay, this is what we know about what's happening. This is what I would recommend, but I want to hear from you where you are in this process. Do you want to be more natural? Can we do it? And I'll go and talk about more the technical testing of fertility, but I think that a very important concept that that Sara mentioned is not only the emotional part, everything that happened with the couple, and I see it all the time or so frequently that especially the female and male coping mechanism and what they go through fertility are so different, and that caused so many clashes and issues that were never there before. And I usually just let them know. And of course, I'm going to send them to Sara, and like I'm not going to, but to let them know this is very normal. You know, the coping mechanism is different, the worries are different, and it's very normal to have all those clashes. And the good news, they go away after things are solved. So it's not one of those things that leave scars forever. But most importantly, it's very common. And so moving forward now, and I definitely, I want to talk a little bit about diagnosis of infertility. And I wish So the first question is, when should we start worrying? Because the reality is nobody wants to go to a fertility specialist. You know, it's almost like going to the dentist. It's like, why do I need to go there? There is also like a loss of control, especially when it comes to fertility. Like, I want to try one more month. So I want to see if it's going to work. So the question is, when is the real cutoff? They're like, okay, I need to go there. Next slide. So the definition of infertility, according to the ASRM, which it's a very technical one, is that infertility is, the definition is 12 months or more of appropriate timed unprotected intercourse or IUIs. I mean, this is a very complex definition, but, you know, the bottom line, couples that live together that have regular intercourse, you know, should be able to conceive within 12 months. Now, of course, there's many exceptions for that. For example, if the couple is not having a regular intercourse, and it's not uncommon that I sit with couples in my clinic and they said, well, you know, we have intercourse, you know, once every 2 weeks. This is not enough. Or, you know, we live together, but he travels a lot, you know, or he cannot ejaculate, or million things, and you realize that they could have not gotten pregnant. Or patients, for example, that have irregular periods. So there is, for those patients, or there's no reason to wait the whole year. Other exception for that, next slide, is of course women. How do you move the next slide? Women at age 35. We usually tell anybody at age 35 or above to basically after 6 months. And the reason why we want it to be a shorter duration, because we want to have more time to be able to diagnose and possibly treat or overcome any specific issues. Now, there are a sheer amount of couples and singles now that are coming to do fertility testing prior to conception. These are couples in their early 40s or late 30s, or even single that are about to get married. And I really see a big advantage of having fertility testing doing as early as possible. And the reason for that is that there are many fertility diagnoses that we can take care of, but can take time. So if a couple comes early enough, let's say somebody's in age 38, 39, or 40, and we discover there is a sperm issue, it gives us enough time to try and work on it, which, you know, can take 4, 5, 6 months, as opposed to just say, oh, you know, you need IVF and ICSI. But if couples come to us and they're already in the, you know, 41, 42, sometimes we don't have the time. On the same token, if we discover that the fallopian tubes are closed, you know, the couple can have intercourse for the rest 7, 8, 9 years, and they won't be able to conceive, and that they're missing on this opportunity, or the window of opportunity of getting pregnant. So I think the big advantage of an early fertility testing is really knowledge. And as long as you do it with a fertility specialist that are honest enough, and I feel that I know many great fertility specialists in the L.A. area and outside that really want to help. And the purpose is not to see somebody say, you know what, everything is great with you, why don't you do IVF? I mean, this is really not. The purpose is, why don't we see, well, if there is any problem, if there is no problem, wonderful, then try and conceive naturally. If there is a problem, let's see, can you do some TCM? Can we repair it in a different way? Or vice versa. Sometimes we have women that are single or just dating or just getting married, and they want to have kids. Let's say, oh, you know what, I want to have I'm now in my 30s, but I really don't want to get pregnant until I'm like 34. And I said, let's just do some basic fertility testing, because if your ovarian reserve, the number of eggs that you have, is great, and the sperm looks good, then great, wonderful, you can keep your plan. But if you have, for example, diminished ovarian reserve, we see that your ovaries are acting older, you might have to change a little bit those plans. And I'm a big believer that you can, especially something like motherhood and become pregnant and wanting to have a child cannot dictate only by a chronological age. If somebody's not ready to be a parent, you shouldn't do it. But if somebody's saying, I'm ready, but I don't know if I should do it now in 2 years, and her ovaries are depleted, then I would say, maybe you should consider doing it a little bit early, or at least follow up on that. So I think that's a big advantage of early fertility testing. And those testing can be honestly done in 2 appointments. We do one ultrasound and blood work and another one if needed to test the tubes. And within 2 weeks, we have all the information that we need. So next slide. So I want to talk briefly about causes of infertility. Let's move to the next one. And every time when I look at how couples what's the cause of infertility, we always divide it into male and female. And it's very interesting that a lot of the time it's both of them. There is commonly a male and a female component, and each of them feel guilty about that in different ways. But male infertility, it's at least 40%, and there is definitely an increase in male infertility worldwide, especially in westernized country. Nobody knows why. There are many different theories. The other thing that is very misleading, that it could be the most handsome, young, athletic guy, and he still have a very low sperm, and vice versa. So you never know. A low sperm count does not always give signs. I feel like females infertility sometimes can cause irregular periods or other things. With male infertility, sometimes there is diminished, they have some sexual dysfunction, but a lot of the time there is no way of knowing until we do a semen analysis. So about at least 40%. And the other is the female causes, and we talked about ovarian function and tubal and so on. So talking a little bit about how we get pregnant, and every time when I look at it, it's a miracle for me that there are even babies in this world because it looks so complex. And I remember studying it, I would think to myself, there is no way I can get pregnant. Like, if all of this need to happen every time, like, how is that even possible? Because it is in some ways very complex. But basically, if we looked at the diagram, the first one, there is ejaculation in the vaginal area. A lot of the sperm, by the way, get destroyed already during this phase, and that's why sometimes IUI, intrauterine insemination, is helpful. The sperm have to swim all the way up to the tube. Fertilization actually happens in the tube, not inside the uterus. We have ovulation of the egg captured by the tube. The formation of the embryo is inside the fallopian tube, and then implantation happens about 5 days later inside the uterus. So all those things needs to happen in order for a pregnancy to actually happen. So next slide. So with male infertility, the sperm is produced by the testicles, stored in the epididymis, and then produced outside through the vas deferens and through ejaculation. Next slide. So the next slide. Can we get to it? So when we do fertility testing, what we like to see is testing the ovaries, tubes, uterus, sperm, and I leave others. So let's move to testing the ovaries. What things we need to know about the ovaries? In the next slide, we have 2 main things that we want to know. One, are women ovulating? And it's something that a lot of women that have infertility are very concerned, because there is so much reading about luteal phase defect and is your progesterone is good enough. But the reality is women have regular periods, they do ovulate. And I don't see really the reason to check the progesterone level, although some women really wants to check it and it's fine. But the reality, if women have regular periods, they ovulate every month. Otherwise, they would not get regular periods. So the first thing to know whether you ovulate or not, are your periods regular? And regular, it's between, 25 to 34 days. So even if the periods don't come exactly the same time, if they're a couple of days apart, it's still okay. So one thing is like, are your periods regular? The second, and it's a very, very distinctive cervical mucus, that some women are very conscious of it or aware of it and some are not. the cervical mucus usually it's one of the most reliable signs of a natural ovulation or almost ovulation. So the cervical mucus is basically the peak estrogen level that happened just before ovulation. And it's equivalent to a positive ovulation kit. In fact, I tell women, you know what? If you know when your cervical mucus is different, you can test for yourself an ovulation kit just to know it's true, but this is the most reliable factor of pre-ovulation. Then I recommend for patients to have intercourse that day and the next day because ovulation will happen within 24 hours, 48 the most. But not all women get the cervical mucus, not all women can say. But for those lucky ones that do, you honestly don't even need to check ovulation kit because the cervical mucus, the distinctive one, the very sticky and different one that happens around, day 14 mid-cycle is the one that indicates that ovulation is about to happen. The third one is the ovulation kit. And actually, ovulation kit is not a bad way to, or it's actually, I find it an effective way to try and improve your natural fertility. So the ovulation kit, what it does, it detects the LH surge that happens a day or two before the natural ovulation. There are many kits out there. The advantage and disadvantages of the kit. The advantages is that it helps you know when is the most fertile days of that month. And especially going back to Sarah's kind of lecture about this time intercourse, it gets very tired for couples that are trying to conceive to have intercourse every other day. It's tiring, it's not fun, it's exhausting on multiple levels. And be able, although it's not very sexy and natural, saying, instead of us having intercourse every other day, which at that point the couple knows that they're doing it for that, let's have intercourse when we feel like, but also there's going to be these 1 or 2 days that are the most important one, and we trigger the intercourse for that time. The disadvantage of the ovulation kit that it can drive women and couple crazy because those ovulation kits are not easy to interpret. Some of them will tell you that you're supposed to get 1 line when there is no ovulation and 2 lines when there is ovulation. But it tells you that the second line needs to be darker or the same as the first line. It drives people crazy because it's like, I don't know. Like, I can tell. Is it darker, not darker? Is it darker, not darker? And I always tell my patient, don't worry. Send me a picture on my iPhone. Don't put your name, so it's going to HIPAA compliant. I'll tell you. But the reality, if there are 2 lines, you're fine. And then there are other kits that are even more complex and have like flashy light and shiny light. And the more complex they make it, the more anxiety provoking they are. So I think one of the downsides of the ovulation kit that are not always easy to interpret. And that's where the fertility specialist will help you with that. Myself, and I'm sure that others will tell you, just call me. Call me, send me a text, call the office, we'll let you know. Actually, texting is not good, but email me. The other thing is that there is some false, those ovulation kits don't work for all women. There are a certain percent of women that the ovulation kit don't work for them. They either show all the time negative or they either show all the time positive. It can be very misleading. For those women, one way that we can detect ovulation is following by ultrasound. It's a little bit of an expensive way sometimes to do that and not very easy because you need to come to the office more frequently, but we can actually look at that follicle and then follow up, see when ovulation is going to happen and follow up and ovulation actually happens. So a little bit of a more complicated way to do it, but it can absolutely be done. So ovulation, that's the first thing we need to know. And as far as fertility testing, I tell my patients, from my point of view, if you're having regular periods, you're ovulating, and I can, of course, help them determine when is your natural ovulation occurring and find a way for them to know that. Next slide. The second thing that we want to know about the ovaries, other than their functional, meaning are they hormonally, ovulating every month, it's what we call ovarian reserve testing, meaning how many eggs the ovaries have compared also to the chronological age. And as you know, there is, women lose eggs actually from birth until menopause, basically every month. And it's of course when we are younger, we assume that the quantity of eggs is great, but the reality is that the ovarian age does not always reflect the chronological age, and could be younger women that the ovaries are just aging quicker. So there are different tests that can give us an estimation of the quantity of the eggs and sometimes quality. So there are a couple of tests. One of them is an ultrasound, the second are blood work. So the ultrasound, we do something called antral follicle count. And basically, the antral follicle count are the group of eggs that started to grow that month, and it's a reflection of the total amount of eggs that women have. For example, if you look at the ovary in this picture, you can see these little round circles, and those reflect those follicles. Women in their 20s might have 20 follicles between the two ovaries. Women in their 30s may have about, let's say, 12 follicles. Women in their 40s might have 8 follicles. So if I do an ultrasound at the second or third day in somebody who's 30 or 35, and I see about 10 or 12 follicles, it looks great. I already feel great about it. I said, you know what, we can do some blood work, but your ovarian reserve overall looks very adequate and good for your age. On the other hand, if I scan somebody in age 30, 35, and I see only 2 or 3 follicles, that indicates that their ovaries are acting older. That does not mean that she cannot get pregnant. And this is very important when we interpret all these. None of them are like doom, like this is it, you're not going to get pregnant, you're always like you're 45, you need to do echinacea. None of them is right. It only means that we need to understand why maybe that couple is not getting pregnant, how efficient we need to be with fertility treatment, what protocols we need to do, and keep working on it. And that's very important, not to take those tests as a kind of, okay, this is not going to happen for me. So antral follicle count, it's a very sensitive way of assessing ovarian reserve. The second one is a combination of blood work that we do on the second or third day of the period. One of them we can do at any time of the period, and it's a combination like a hormone called FSH, estradiol, and AMH. Of those 3, I have to say that the AMH, anti-Mullerian hormone, is one of the most sensitive tests to detect ovarian reserve. The advantage of the AMH, it can be done at any time of the cycle. So patient can come in at any point of the cycle. We can draw the blood work and know. And we want the AMH, of course, there are different criteria, what's the number, but it gives us a very good indication of the ovarian reserve, as opposed to the FSH and estradiol, that are hormones that change from one month to another. One more important concept is that the ovarian reserve testing need to be interpreted as a group, meaning if somebody has, I do a scanning and somebody has 6, 7 antral follicle, have about 10 antral follicle, and her AMH is a bit on the low side, that's, one second. Amber, I can't, I'm giving a seminar. I cannot talk to anyone. Why? I'm so sorry, it's clinical work, but if we basically, let's say I'm scanning somebody and she has about 10 antral follicle and the AMH is slightly on the low side, I interpret it one way as opposed to if I scan somebody and she has a low antral follicle and also a low FSH and estradiol. So the interpretation of those blood work need to be taken in a group and not as a single test. There is also a company that I use, Reprosource. There are others that specialize in ovarian reserve, and we send them the blood work, and they actually give us a full report that include hormonal testing for like FSH, estradiol, AMH, and something they call egg retrieval score, which is like if we were to do any treatment such as IVF, how many eggs we get. Now, we don't really need those numbers as far as egg, but it's another indication of how's the fertility of that particular woman compared to her age. So that's the kind of ovarian reserve testing. Next slide. So again, from the ovary point of view, what we need to know is ovulation, not ovulation, and we talked about it. The ovarian reserve testing, that's the antral follicle count, and the hormonal testing. The second is the tubes, and the fallopian tubes and uterus. So uterine factor as infertility are pretty rare. but they can be, but they're not as common. But closed fallopian tubes, for different reasons, they're not that uncommon. And the other problem with that is that there is sometimes a misconception that if the fallopian tubes are closed, it will give any signs. The reality is that it doesn't. You know, I would say that 99% of women that have a closed fallopian tubes or blocked tubes will not give them any signs. It doesn't cause irregular periods. It doesn't cause any pain. The only way we would know it is by doing a test. The test, one of them to look at the fallopian tube, the hysterosalpingogram, it's a test that it's done either at a fertility center or radiology. The radiologist or the fertility specialist inject a small amount of radiographic dye that looked into the shape and the shape of the uterus and whether the fallopian tubes are open or closed. And we can get a couple of results. One, the tubes are open and the uterine cavity is perfect. Wonderful. The HSG test by itself can increase pregnancy rates for 1 and 2 months. The second result was, you know what, the uterus was perfect, but the fallopian tubes were initially closed with mucus plug, and the HSG test was able to open it. Then great, then we kind of solved the problem. The third one will be 1 or 2 fallopian tubes are blocked. And if 1 fallopian tube is blocked, it's good for us to know, but the patient can still get pregnant naturally. If both of them are blocked, we know that no matter what we do, we probably have to move to IVF. Next slide. So other ways to test the uterus other than the tubes are tests such as ultrasound, that we can look at the endometrial lining, serum infusion hysterography, and so on. So I'm not going to get into that, but there are different imaging testing that can be done other than the HSG. I think that the big advantage of the hysterosalpingogram that it's one test that look at both. Next slide. These kind of are imaging, but I don't have a pointer. Can they see my pointer? Not so much. They just show all kind of anomalies within the uterus that can be detected by an HSG, such as scar tissue and polyps, but you know, we'll move to the next slide. Yeah, let's move to the next slide. And this is another test that we do on patients that we are concerned that, for example, we have to do IVF and we at that point don't need much information on the tube. It's an easier test that can be done in the office. It's called saline infusion hysterography. It's a very sensitive test to look at any kind of anomalies within the uterus, polyps, fibroids. And if you can see, the first test look at a completely normal cavity. I cannot see my slide, my pointer, and the other ones look at anomalies within the uterus. Yeah, next slide. Finally, hysteroscopy, and I think there's some centers that really like to do hysteroscopy as a fertility testing. Hysteroscopy is a surgical procedure. I personally don't think that we should put anybody through a surgical procedure unless there is a clear indication. But, you know, it is indicated when we see polyps or fibroids or things that we think will affect implantation. And it's, you know, a procedure that I personally do only if there is a clear indication for that. But, you know, those are imaging of a hysteroscopy. It's an in and out procedure. There's no cutting. We go in with a camera. If there is a polyp, we remove it. It's overall a very easy procedure. But with anything, I think that it's easy if it's not done on you. So I think that I try to avoid any surgical procedure unless I really think there is something that I can correct. Next slide. Finally, testing sperm. And, you know, it's interesting. There is, I feel like females are more collaborating, more, you know, when we have to test fertility, one of the difficulty we sometimes find is actually testing the sperm. One of the biggest worries men have is really that there is something wrong with the sperm. It's almost like it's okay if the female partner have any kind of fertility issue, they can cope with that well, but the biggest concern is what if my sperm is low? And sometimes even getting the male partner to do that is not the easy task. Now, A couple of misconceptions about testing the sperm. Testing the sperm, it's a simple semen analysis. The men have to abstinence between 2 to 4 days, and the reality is that the longer the abstinence, the lower the quality of the sperm. So there is some men that think, oh, I'm going to have a semen analysis. Why don't I accumulate sperm now for 6 days? That one, it will show that I have a lot. In reality, the quality will go down. So we always tell the man, and I know it's go back to Sarah's kind of lecture about, telling patient what to do, but short abstinence, 2 to 4 days the most. The sperm look at different parameters. We look at the volume, at the concentration, motility, shape of the sperm, and so on. What's very important to know about testing the sperm is that one test is not enough. So if it's a low sperm, it's always good to repeat that. Despite what a lot of, you hear it at many places, oh, if the sperm is low, we just have to do IVF, we just have to do ICSI. This is incorrect. I think that male infertility needs to be treated the same way that female infertility. We need to try to understand why the sperm is low. We need to try to correct it. For example, Denise will be able to talk more about it, but TCM could be very helpful for that. Antioxidants could be very helpful for that. And in my view, we should try and improve the sperm the best we can before moving to IVF and ICSI, unless, of course, the patient's age is at an age in which we don't have the time to do that, because it can take 3 to 6 months before we can improve sperm. One more thing to mention about testing sperm is that there are newer tests now that we're using that looked more into the quality of the sperm. So there are many couples that maybe have unexplained infertility that underwent regular tests, and the sperm looks completely normal, to then just discover, actually, we are doing this new test and realize there is other problems that we were not aware before, so it's not so much unexplained. So testing sperm is very, very important. It's a very easy test. We can get the result within 24 hours. Highly recommended. Next one. So finally, my take-home message. I think that infertility is not the easiest journey, but it is a journey. And it's not like many journeys in life. It's not necessarily one that we wanted to have, but that's kind of part of it. Is what it is. I think that getting a lot of support and help from specialists such as Sara, support group, meeting with fertility specialists as soon as possible, just to have an idea of what's going on, and just having, everything is okay, keep trying, or why don't we improve or continue TCM, can be very, very helpful. And also very important, always, work with fertility specialists that kind of accept your view of things, and you have to feel comfortable with treatment. Open to questions. I don't know if we have time now, or there is my email and my contact info and so on.
Hi, Nurit. Dr. Winkler, thank you so much for that. Great information. We don't actually have time for any questions now, but we'll make sure that we put your email, and we'll send out your email to anybody who needs to get a hold of you who has a question. Is that okay?
Yeah, absolutely.
Okay. Thank you so much for all that. I hope you have a great day.
Thanks.
Okay, that was really informative, and I couldn't agree more with her as far as the early testing goes. I see a lot of women who come in, and so much time has been wasted. I don't, just a personal side note, I don't know why the rules are so set in stone that you have to wait a year or 6 months to do that, especially if you want to have a baby. There's so much that you can do to, if there is something, you want to start ahead of time. And that's kind of where my medicine is so great, is really trying to, I'm not there, honey, beginning. I'm sorry. That's where my medicine comes in, where we really try to help prepare your body to get healthy as possible, and so that you can get pregnant easily and have a healthy baby. So now it's my turn to talk to you and share a little bit about what I do and how you can supercharge your fertility. So I'm Denise Noyer-Erez, and I'm also been called the fertility godmother because what I do is I like to help take people under my wing and really help them and support them on their journey so that you get the best steps and you don't waste any time. Just a little bit about myself is I studied exercise physiology and nutrition as my undergrad at Cal State Northridge, and I was always interested in health and wellness and preventative care. And when I finished school, I wasn't sure what I wanted to do, so I want to say divine intervention, if you will. I ended up at Chinese medical school. And honestly, I really struggled with Chinese medical school because it was so different. And I have this science background where I like to see how things are working. So I wasn't sure I was going to actually practice, but somehow I finished. And at the very end, I was blessed to go to China. And in China, I saw how they integrated the Chinese medicine, the herbs and the acupuncture into the hospitals. And that is what really encouraged me to do something that I wanted to do, and where I have this beautiful medicine and to work with doctors so that we can create a holistic and really serve our couples or women and men at the best, at the highest level. So that's a little bit about me. So if this talk is for you, if you are tired of sitting on the sideline and just waiting for that special moment when it's your turn to have that positive pregnancy test. And this talk is for you if you're tired of being disappointed and want to start doing something different. And this talk is for you if you're looking for natural steps that you can take so that you can hold your own baby. So today we're going to discover how you'll supercharge your fertility. Specifically, what I'm going to cover is what your cycle is telling you about your chances of having a baby, when the best time to have sex is, because timing is everything, and how to recognize positive changes. I'm going to teach you as much as I can with the limited time that we have, and then I will promise to show you how to take it further. So in my clinic, we see tons of women who really want to get pregnant, but their bodies just aren't ready. They've either gone through multiple IVFs and they haven't worked, or they've been trying for years and things haven't happened yet. They're super, super stressed. They're maybe not sleeping right. They probably aren't eating right, or some of them even do research and think that they're eating right, but aren't really eating to nourish their bodies properly to have a baby. And, as we've heard and as you probably have experienced, we think that having a baby should be easy because it's natural, but actually it's very difficult. And a lot of things have to happen just right for you to get pregnant. And if just one thing is out of whack, then the whole process could be interrupted. So your monthly cycle is a huge clue to what's going on in your reproductive health. Okay, your period gives some valuable information of that is indicative to your fertile potential and your chances of conceiving. So a normal cycle is usually around 28 to 30 days. And then Dr. Winkler said 24 to 35, I think. But from a holistic point of view, we actually feel that it's really important to be closer to 28 to 30, 20 days. And the reason that is because during your body needs to prepare the egg. And if your cycle is short, then your body doesn't have enough time to prepare for a healthy ovulation. And in fact, there's a lot of studies that show with short cycles, it's especially detrimental to your conception. It decreases your chances of getting pregnant from 50 to 75%. And also, if your cycle is too long, over 31 days, then there might be some imbalance in your hormones, and the egg is, you won't have a strong ovulation, or the egg gets too ripe before it's released. So you can have a higher chance of miscarriage due to a chromosomal abnormality or some other type of imbalance. The good news is that if your cycle gets back into balance, then your pregnancy rates return to normal. So from a Chinese medical point of view, we break the cycle into 4 phases. We have the period, we have a post-period, an ovulation phase, and then a follicular phase. And depending on what's going on with your body is how we do your treatment. So let's talk about your menstrual cycle first, okay? So what's important to us when we look at your menstrual cycle is we look at the amount of blood, the quality of your blood. What color is it? Do you have any clots? What's the texture of your blood? Is it thick and sticky? Is it too liquidy? It gives us a lot of valuable information. Are you having any pain or discomfort? How many days you're bleeding? And if you have any spotting before or after your menstrual cycle. So what it should look like is you should bleed for about 4 to 5 days, and you should have a nice, good flow. And the blood should be nice and red, not dark brown or sticky or purple. No, and you shouldn't have too many clots. Also, as far as pain, there's definitely a lot going on down there. And so it's normal to feel sensation, but you should not have pain before or during your menstrual cycle. That's an indication of an imbalance and something else going on that should be corrected. If you don't bleed for a good 4 or 5 days, then that's an indication to us from a whole Chinese medical point of view that you don't have enough blood to nourish the uterus or your eggs. So there's a deficiency there, and we'd really focus on building up. And the same thing is if you were bleeding too long and you were having these really heavy periods, then we would, and say that you didn't have any fibroids, as we definitely want to make sure that that was ruled out, or any cyst. But if your body was bleeding, having really heavy painful cycles, then there would be an imbalance that would need to be corrected. Okay, so let's talk about the post period. So you start bleeding, sorry. So around your menstrual cycle, and you start shedding around day 1, you start shedding the lining. And at the same time you're shedding the lining, the second day, your body's already starting to rebuild itself. And you want to make sure that you have a nice, good flow. And then in the follicular phase, not only is your body losing the lining and giving a chance to regenerate, so you have another chance this next cycle, but your body's also starting to produce follicles to get ready for ovulation. So even though you're bleeding, your lining's regenerating, now you're also producing cycles. And what happens when you ovulate is your body has already recruited the follicles that it's going to ovulate this cycle. So there's like this race that's going to happen, and your body, your ovaries and your brain are communicating, and most people generate, as Dr. Winkler said, anywhere between 2 to even 40 follicles that cycle. So your body's recruiting all the follicles to grow, and the race begins. And then around cycle day 7 to 11 is when your body decides who the winner is. And the winner gets an all expense paid into the fallopian tube. And that's decided around day 7. And so what happens is after the winner is determined, all the other follicles start to degenerate and get absorbed back into the body. And this allows the body to really nourish that one follicle and that one egg that's growing in it, to be strong and healthy. And then usually around day 14, it's like 5 days later, your body, the follicle will be large enough, which is usually around 24 millimeters, and it'll erupt and the egg will pop out. And this then at this time, the fallopian tube actually moves closer to the ovary, and it has these little fingers on the end, and it grabs the egg and pulls it into the fallopian tube. And at that time, it would be ideal if the sperm were already there waiting to fertilize it. So that would be the most successful chance of having a successful fertilization if the sperm were there already. And it's really important as well. We tend to focus a lot on the women, and I was so happy to hear Dr. Winkler emphasize a little bit about the men, because the male sperm is 50% of making the baby. Each of you will give 23 chromosomes. Each of you are very important for the DNA that you're going to give your baby. And I love that she emphasizes that. And I also want to support that as well, is that it's important for the male to be really healthy and have strong sperm too, so that you can fertilize the egg. So if the egg doesn't get fertilized, then it'll just pass down the fallopian tube, and then you'll have a menstrual cycle. Your body will be signaled that it didn't work this time. Let's restart and try again. And then the whole process will start over. So what happens is, when I see a lot of women who come in, and it's not really sad, but there's a sense that women don't really understand how the ovulation process works, and some things that they can do different. So if you will, this is a little bit of my soapbox. What you can do is, let me back up. Women tend to think that they just ovulate right away. An egg just pops out, and if you will, and they have sex and are supposed to get pregnant. But if you think about it, there's actually a lot of talk, or there used to be more, about preconception care. So we are born with our eggs, all of our eggs that we have. And they're just sitting there sleeping, or they're dormant, until our body recruits them. And every month, your body starts to recruit a certain amount of follicles. And it actually takes 13 months. Once your body recruits those follicles, it takes 13 months to actually ovulate that egg. So it takes a lot of time. It doesn't just happen overnight. And there's even another optimal window before, which you guys have heard of as preconception care, which is why it's important to be on prenatal vitamins and folate and choline, vitamin D before, because we are able to dissect those certain parts and find out that they're really important to the health of the baby and the health of the mom. And if we were deficient in those, it caused birth defects. So, but from a holistic point of view, we look at everything in different ways to really help you optimize that period. So there's a 3-month period, and that's really where I created our Aim to Get Pregnant programs from, because during that window is when the egg actually starts to grow inside the follicle. And so that's an optimal time for you to really get healthy, really balance your menstrual cycles if they're off, or really help increase healthy blood flow into the uterus and the ovaries. It's a really optimal time for you. And the same as for the male partner, usually men are constantly regenerating sperm, but it takes about 90 days to recreate new sperm. So that's also a great opportunity for them to get really healthy, to be able to give the best DNA possible, or have the best sperm if you're getting available, if you're preparing to either conceive naturally or even with IVF. Okay. Okay, so let's talk about the cervical fluid. So Dr. Winkler touched on it a little bit. I'm going to just go into it a little bit more depth. So the arrival of your fertile mucus is a sign of the fertile time of the month. The fertile mucus is evident. It can be evident for a few hours or it can be evident for a few days. So you can imagine the longer, the better. And it's really important to have fertile mucus because it maximizes the survival of the sperm and encourages the entry into the uterus. There are 4 types of cervical mucus. There's the G type, which is in the beginning of the cycle. We call it the gate, and it's really dry and pasty, and its purpose is to block the sperm from entering the uterus. We're closed for business. And then as you go into the cycle, maybe around cycle day 7 through 11, we start to get that creamy mucus or discharge. And the purpose of this is really to filter out any of the abnormal sperm or poor quality sperm before it can reach the uterus. So you can imagine the sperm really needs to be strong and healthy to get through some of these barriers. And then the fertile mucus, the S type or the spin barky, is that egg white, stretchy, slippery mucus. And this is your clear sign of ovulation. This is the optimal time to have sex. And the purpose of this is really, it actually creates these pathways for the sperm to move up into the uterus. And at the same time, it also nourishes the sperm. And then you get a P type of mucus, which is really slippery mucus. And that is usually the day before the eggs actually release. And usually you have about 24 hours. The sperm has 24 hours to fertilize the egg in order to make a baby. So some things that can affect fertile mucus or your cervical mucus in general are antibiotics. It can change the pH in your vagina, and you have an increased risk of yeast infection, or it changes the pH so things are a little bit off down there. NSAIDs such as Advil or Tylenol, they actually lower prostaglandin levels, which means because it wants to reduce pain, you actually need this inflammatory response to ovulate. And NSAIDs the effect of that can stay in your body for up to 10 days. Antidepressants, it changes the patterns of your fertile mucus. Antihistamines, it dries all of our membranes. So not just in our nasal cavities, but all of our membranes. So you can imagine things being a little bit more dry down there. And also Clomid, because it blocks estrogen, it inhibits the mucus so that it can bother and can influence your fertile mucus. Okay, so to see changes in your cycle, you want to pay attention to your menstrual cycle. You know, again, you should be having fresh blood, no clots, and you can actually watch changes if you have difficulty with your menstrual cycle. Or you can, same with ovulation, pay attention to your fertile mucus, making sure that you have a good amount of fertile mucus. And then one way we like to change or track is using a basal body temperature. This could be good information for you, but in particularly, I love to use it because it gives me a little bit more subclinical information, and we can track another way of tracking progression in our clinic. So this is what a normal basal body temperature should look like. The nuances of taking your temperatures is you have to take it every morning before you get out of bed, and you should have uninterrupted sleep for at least 4 hours. You can take it orally, or you can take it vaginally. Supposedly, and I haven't played with this yet, but vaginally may be more predictable, and it's something we're going to experiment with in this next month. So I'm just sharing with you. So if that's something that you want to do, you can try that. So this is what we have a normal BBT chart on your screen right now. And the first part is your period and your post-period. And then you have the dip and the spike. And that means that you've ovulated. And that dip And the spike is tells you that you've already ovulated. So if you're using this for birth control, it's not the best measure. But we're really just looking at it for clues to see what's going on in the body. And then technically, during the luteal phase, your temperature should be over 98.3, plus or minus a couple points, but in general. And this will give us an idea of how we can help nourish your body, whether it's warming you up, helping you eat certain types of foods, doing through acupuncture, some herbs, sometimes meditation and breath work, just depending. We try to find all types of ways to help support you. Denise, okay. So this is one of our patients that we had. This was the first one on the left here. You can see how different it is from what it's supposed to look like. It's really up and down and all over the place. From the first half, she ovulates pretty late, and then it's kind of up and down again. Then the second cycle, you can see it's still a little bit up and down, but after she ovulated, it continues to go up. So that was just in 1 month of working with the patient. You could definitely see there was some changes there in the second half of the cycle. And so what I just shared with you was the first step in our Aim to Get Pregnant program. And we also really talk about your journey and what's been going on with you. We make sure that you have a Western diagnosis, or we'll recommend what test you should have so that we know we can move forward. There's nothing that I definitely don't want to waste anybody's time. It's a very delicate time in someone's life, and timing is crucial. So it's really important that we make sure that you have all the proper tests, because if you did have a cyst or a fibroid, then we really can't help you. If you had a blocked tube, we need to correct that. And a lot of times we work together with the doctors, so we're helping, balance doing other things with your body at the same time. We're finding all that information out. And then our second step is really we do for not everybody, but for I'd say about 85% of the women that come in, and we try to always get the husbands on board, is we'll do a gentle cleanse. And the purpose of the cleanse is to really launch you into healthy eating habits fast. And even just doing this one step, we've had so much success and people just feeling so good, and it helps them change emotionally, and it's been a wonderful part of the process here. And then we focus on rebuilding, and we'll educate you on supplementation, if Chinese herbs and other ways. And we're constantly balancing your body, nourishing your body, making sure that you're getting healthy blood flow, stimulating the ovaries so you have a strong ovulation, fertile mucus, so that everything is looking optimal. And at the same time, usually in our office, we usually give tips to help the partner, whether it's nutrition or supplements. Sometimes it's herbs. We usually do some Skype calls, because most of the patients we see, it's really difficult to get the men in. And that's okay, as long as they're doing something to be really healthy. Sometimes that works, and sometimes they need acupuncture, but for the most part, that's what we find to be successful. And then we're constantly helping you stay on track and reevaluating. So I know we covered a lot today, and in honor of you investing your time, and especially with all your patients, I'm going to offer you to have a private one-on-one Aim to Get Pregnant strategy session with me at no cost. And this is a one-on-one session. It's a value of $250. And during this session, we'll meet for an hour, and we'll assess your current situation and determine what the best next action is for you. Okay, so we'll send you an email, and with that link, if that's something you're interested in. But there is a catch. You do have to qualify So if you're interested and you'd like to do that, set that up, just fill out the form, send it in, and then we will make an appointment with you. We only have, because I am giving a whole hour of our time, we only allow 4 of these per week, and 4 of these per month. So, and we'll be giving those appointments on a first come, first save basis. Is that right? Did I say that funny? Anyways, a first come, you know what I mean, I hope. So anyways, thank you again for investing your time today. I hope you got some valuable information and we were able to create some hope, give you some information about fertility testing. Maybe you have more insight about what's going on with your body, when to have sex is, when to take a good break, and try to keep things exciting. And what's important, I know this can be a challenging time, or hopefully for some of you it's an exciting time, but just remember that you're important and your relationship is important. So make sure to get the support that you need. And thank you again for coming. Keep your eyes out for the emails with all the information. Take care. Have a good day.